Good morning, guys. It's 6:40 right now, and I'm gonna show you what my day is like. I know it's been a while since I've uploaded a video. I was in a little rut, but now I'm out of it, so here we go. They just called it anesthesia alert.
Tower South.
There's another anesthesia alert. Just changed to the scrubs. Might head over there and see what's going on. Went to that airway, and she was a lady who was setting not too bad. It was in the low 90s, but they decided to intubate her. Go ahead and do that because she had COVID, and that's how my morning started. Today is kind of crazy. It is a full day. I'll tell you guys what we have. Look at all these cases that we have. Boom, 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 boom. This is the one that I'm doing. COVID positive. During a COVID case, we moved the anesthesia cart outside of the operating room. We'll have a runner, so if there's anything that I need on this cart that's not already in the room, then they'll be out here to pass things to me into the room so that this whole thing can stay clean. I like to gown up, wear my N95, got the eye protection, double glove, because even though I'm vaccinated, you can still get COVID. So I'm going to try and find one of those surgical gowns, thick surgical gowns that I can wear so it's clean. Extra large. Extra large. Looks like it'll be extra large for me. This is my setup for a COVID case. Tape or airway tongue depressor. I tape my drugs that I need immediately for induction, extra drugs for wake up, drug tray, narcs, and everything is pretty much wrapped in plastic. Got my gown on. I'll put this on when the patient gets here. It's showtime. This is in the room now. I'm gonna go get the case started. Just finished transporting that COVID case. Cleaning my hands right now. I'm gonna take all this gear off. So that patient was a 67-year-old lady, and she had a subdural hematoma. neurosurgery had to go in and evacuate it. We intubated her, easy airway with the glide scope, and it was pretty straightforward. The only other thing was, trying to keep the room as clean as possible, keeping yourself as clean as possible. Case finished. Case finished, and we kept her intubated, transported her back to the ICU. I'm gonna toss this too. So this is what happens when you wear the N95 for 3 hours. Not cute. I have to total up all the drugs that I used during the case. It wasn't too much. It was 200 of propofol, 200 of fentanyl, no Dilaudid, no Versed, and that was it. So I'm going to return these drugs, get some new ones, and see what case I'll be doing next. Yep. Good news. It's 11:45 right now, and I don't have to start another case. My attending told me to go get lunch, so that's what I'm gonna do. Yes. The board looks super busy today. It's pretty much a full day. Since it's so busy, management decided to buy us some pizza for lunch. Yum. Finished lunch. Now my next case is a hypophysectomy. It's done with neuro and ENT together. And we'll get the patient right now. They are in pre-op. So my patient is a 68-year-old male, and they're going in for a hypophysectomy. He's got history of hypertension, OSA, CPAP, had a PE on Wednesday, hypothyroidism, and he's allergic to penicillin. We did a general anesthetic for him. He got intubated, easy mask, and it was an easy intubation with MAC 4. IV access, he came down with a tongue gauge in the AC, and then we put in a right 15 gauge in the AC. I put in a left radial A-line, and that placement was with ultrasound. They said this case was going to take 6 hours, so I can't really record much for you guys. This is where I'll be. Sorry I look kind of rough, but it's been a long day. It's 6 o'clock and I finished the hypophysectomy. I'm returning my drugs now. We extubated the patient successfully and transported them to ICU without any problems. Gave report to the nurse, and now I'm gonna close out the chart. I insert some vital signs. And that's it. What else? See, we have 2 more cases to go. One is that catheter removal, and then the second one is a kidney transplant. It's 7 o'clock, and I don't have to start another case. They gave me the airway phone. If an emergency airway from the ICU or the floor happens, then I have to go to it, intubate the patient. So these are the cases that need to and are going on right now. These 2 green ones are happening at the moment. This kidney transplant right here still needs to go back, so this one will go after this one is done. This one probably has 1 to 2 hours left, so this one won't start until maybe 8:30, 9 o'clock. And then something that's not on the board is an emergency retinal detachment coming from another hospital. So they have to get to our emergency department and then come up to the OR, then get operated on. Might be about 8:30, 9 o'clock as well. We probably won't finish all of our cases until I'd say 10 p.m., 11 p.m. the latest, and then that'll be my 24-hour shift. Yeah, you know, the days that we finish everything by 1 p.m. and get to hang out for the rest of the day doesn't happen as much anymore. It's pretty rare. Things are getting a little busier. One of my attendings, my favorite attendings, has a friend with a farm, and she just gave me a bunch of eggs. I put them in this suction canister and then take it home. Since it probably won't be till another hour, hour and a half until my case starts, I'm just gonna hang out in our break room and watch a little bit of TV. Okay guys, it's 9 p.m. and my detached retina is finally here. They are in the emergency department getting ready to be admitted. So I'm setting up my room and hopefully it'll be nice and quick. This is my AIRWAYS setup. Mac blade, laryngoscope handle, 7.5 endotracheal tube with a 10cc syringe attached. I'm not sure if we're going to intubate the patient or just do an LMA, or we might even do a little bit of sedation. Depends on what the surgeon wants to do. So I'll have everything set and ready to go. Some surgeons will do a block for the patient, and we can just get by with the LMA. What else do I need? Oral airway, tongue depressor, and then maybe a little bite block. Okay, so this is my AIRWAYS setup. Tube, just in case, LMA, probably will use that. Some lube to go with the LMA, tongue depressor, oral airway bite block. Just spoke to the surgeon. He wants the patient to be intubated. So we're gonna get some drugs. Got my tube ready. See if this patient is ready to go from pre-op. Come back and get this done. Alright, got my drugs. Basic, standard drugs. 2 proparols, 1 fentanyl, 1 Versed. Dexmedetomidine. That's 4 mics per ml. This can be run as an infusion, or you can bolus it. It's 1:45 right now, and the eyeball case just finished. I woke him up with Precedex. It was a nice smooth extubation, and now I'm going to return my drugs and then go to sleep. The resident has the airway phone, so if there are any emergencies, I won't be doing it, and the other anesthetist is up for any emergency case that goes to the OR. That means that I will get to sleep for the rest of the night. Yes. Bye, you guys. Thanks for watching. Good morning. It's 6:45 right now. Just got my lunchbox. I'm getting out of here. Slept the rest of the night, so that was good. Didn't go to sleep until 2 a.m. though, so only 4 hours. I'm gonna go home and sleep some more.